when you are looking at therapy or a program or coaching or whatever it is for your child, we have to kind of shift the focus from, does this make me feel good? Do I feel peace of mind? Do I just feel good that my son is doing something or talking to someone that he likes? And let's shift away from just that emotional aspect to it to more of the reality. Let's go from being reactive to proactive. Let's be proactive here and say, okay, am I seeing real world progress? Is there less fights at home? Can he initiate, persist, and complete non-preferred tasks at home and at school? Is he making friends? Is he keeping friends? Is he having varied experiences? Does he seem, more pleasant and more regulated? Can he talk to me while he's in the car? Can he help me at the grocery store? Is there real world progress coming from this thing that you're devoting a lot of time to?
Welcome to the ADHD Guys podcast with Mike McLeod of Grow Now ADHD and Ryan Wexelblatt of ADHD Dude. Learn about parenting kids with ADHD from two male licensed professionals who specialize in ADHD and executive functions. No fluffy parenting advice, only practical information that will help you help your child.
Hey everyone, welcome to the ADHD Guys podcast. My name is Michael McLeod from Grow Now ADHD, and I am an ADHD and executive functioning specialist.
And my name is Ryan Wexelblatt from ADHD Dude. I am a licensed clinical social worker who specializes in ADHD. So, Mike, today we're going to talk about what are the evidence-based treatment recommendations for kids with ADHD. And I think this is really important because, as you and I both know, most parents are never provided with this information. And on top of that, I think what happens with a lot of parents is when their child is diagnosed with ADHD, let's talk about kind of the typical trajectory that we see happen. I mean, you might have something a little different that you see, but what I typically see is child is diagnosed, the pediatrician or whomever refers them to an individual therapist, often a play therapist if they're younger, maybe a social skills group, and basically that's pretty much it. Once in a while they might refer them to occupational therapy, and then what the typical story that I hear from parents is, well, we started in play therapy or individual therapy, and we've been doing it, but it doesn't seem to be helping with these things. And then often I find they just wind up getting frustrated and stopping treatment, or they go from maybe one therapist to another one or one treatment to another one and just start getting even more frustrated because they're just finding nothing's really working. I don't know, has that been your experience?
Oh, absolutely. And really, when you look down at really what's happening here is these specific clinicians that specialize in diagnostics, so that they really make their career by doing these evaluations and these in-depth diagnostics, all of them do it in a different way. There's no one set way to diagnose ADHD or executive functioning challenges. They all kind of do it based on their training and their expertise and their experience. So they're going to use the test that they like, and they're going to interpret the information their own unique way based on their experiences and their training. So what we tend to see is those exact sorts of recommendations. I see lots and lots of recommendations for just basic talk therapy. So I see a lot of kids getting diagnosed with ADHD and executive functioning challenges being sent to a psychiatrist or a psychologist for whether it's cognitive behavioral therapy, dialectal behavioral therapy, but it's a lot of, going in and doing some unstructured conversational-based therapy.
The other thing I think is important to mention is that for a lot of families, the diagnosis comes from a pediatrician, which is absolutely fine and valid as long as the pediatrician has collected data through rating scales of people who see the child, in different environments. Now, that being said, the American Academy of Pediatrics evidence-based treatment recommendations for kids with ADHD is parent training in conjunction with medication management. That's for 6 and up. And there's some other recommendations as well we'll get into. For children under 6, it's parent training first, followed by the use of methylphenidate if necessary. Now, the reason I bring this up is to say most pediatricians do not know this information, which is not their fault. And I often find parents get frustrated when they find out the treatment recommendations and they say, well, why didn't my pediatrician tell them this? And I always explain to them, it's not the pediatrician's fault. They are under so much pressure from insurance companies to see so many patients an hour. And the other piece of it is the American Academy of Pediatrics has, if I'm going to be honest, has done a horrible job disseminating this information. So it's just not familiar to most pediatricians. And I just say that because I want to, stick up for them, because it's not their fault that they're not familiar with this. And that is the reason why they typically refer many families to individual therapy or play therapy, whatever it is.
Exactly. Yeah. I would say just about every single family that reaches out to me to learn about Grow Now services, I would say 99% or basically 100% have already been through several unsuccessful therapies in the past. So they've really put a lot of financial investment, time investment into these therapies that were previously recommended to them either by their pediatrician, the school, or whoever did the diagnostics. And they went and they did this cognitive behavioral therapy, social skills group, play therapy, whatever it may be, and they just didn't see the progress. And I totally agree with you. The American Academy of Pediatrics, they're one thing that they did well was they made it very cut and dry, very black and white. They basically said, these are our recommendations, and all of these things are not our recommendations. And they made their recommendations very simple, cut and dry, and it's there. But they have to do a better job of getting the word out to, all the people out there that you are correct are under, a lot of pressure from insurance companies. But we are getting to the point now where these recommendations have been out for quite some time, and we can't stress enough the number one recommendation is this parent coaching. And I can't tell you how much I hear, my son's been in cognitive behavioral therapy or talk therapy for 2 years, and I have no idea what they're even doing in there. So there's no communication between the therapist and the coach, and the kid just goes in, and the parent will say things like, oh, but he really likes his therapist. They have a good relationship. He likes talking to her, or he likes talking to him. So the parent feels good emotionally that their son enjoys the therapy, but there's no progress. As soon as the kid walks out of that therapist door or ends that Zoom call, they're right back to where they were, cursing and screaming and breaking things and going to, screens or avoiding homework or chores. So if there's no real world progress, then what are we really doing, whether they like the therapist or not?
And you know what, Mike, I think that's such an important part because I think parents often feel that, well, as long as he feels supported or she feels supported, then we're all good, right? But you're not working on learning skills that way. That's the bottom line.
Yeah, it's that emotional part of a parent where, oh, I finally found this person that he feels good talking to. So in a way, it kind of gives the parent the peace of mind where they can kind of check that box. Yes, I followed that recommendation. I got him in the therapy and he feels good talking to this person. But if there's no parent training and no parent coaching and no carryover from that 1 or 2 hour session per week, then what's really happening? ADHD and executive functioning is very time dependent, environment dependent. You have home, academic, social. You have to know what's being discussed. What are the strategies? What's happening? What can you do at home to change the way you use language, increase or decrease accountability, whatever it is. The parent coaching really has to become the number one recommendation as soon as that diagnosis is made.
Mike, when you were talking about schools, it just made me think about something that I wanted to mention. So I'm a former school social worker, and, I worked in public schools, worked in private schools, and I can tell you it was so difficult for the support staff, whether that's, guidance counselor, school psychologist, whomever, it was so difficult for them to, I don't want to say it was difficult for them. Maybe the right thing to say is that every single recommendation for everything was, is the kid in therapy? Are they seeing a therapist? And again, these are school professionals who are not familiar with the treatment recommendations. And, even when I would try to bring up sometimes, I'm like, this is not a kid issue. This is a parenting issue. Like they didn't want to hear that. Everything has to be the kid will be in therapy and therefore things will get better.
Exactly. And this whole concept of I can send my child, like I can't tell you how many parents reach out to me and say, my son has self-regulation and behavior issues in the home, and he attacks his sibling, and he'll even attack me as the parent, and he's addicted to screens. And this whole concept that I can send my child to a therapist, and he can sit in a therapist office and talk to them for 1 hour a week, and that therapist is going to convince them that when they go home to resist the screen, so the parents don't have to do any of the hard stuff, any of the heavy lifting. Parents don't have to take that Xbox out of the house or restrict the screen time. That 1 hour of conversation is going to motivate your child to go home, right, see the Xbox and say, you know what? I have a lot of homework to do. I shouldn't play Fortnite tonight. That's not going to happen.
So, Mike, why don't we do this? We're going to go to the website, effectivechildtherapy.org. Anybody can go to this website, type in ADHD, and what will come up are the evidence-based treatment recommendations. So we're going to go through these and share with you straight from the website what has been shown based on research data, what works and what does not work.
Beautiful.
So, all right. Mike, let me know if you can see the screen.
Yes, I can.
Okay. So, Mike, I think we should start with the bottom so let me just read the top here first. It says, tested behavioral therapies for children and adolescents with ADHD. Let's start with level 5, tested and does not work. You want to go ahead and read that, Mike, and explain why?
So the tested and not work part, which part are we talking about?
So look,
level 5?
Yeah. So let's start from the bottom and work our way up. So level
Perfect.
5, this means tested and does not work.
So tested and does not work, we have listed there social skills training. So what the evidence shows us for ADHD, remember Ryan typed in ADHD specifically here for effective treatments, and level 5, tested and does not work, social skills training. And what did that testing show us? That social skills often make ADHD behaviors worse. So these highly structured social skills groups, run by an adult, constantly prompted by an adult, and heavy focus on external social skills of eye contact, topic maintenance, circles of communication, conversation initiation, those sorts of things, instead of what's truly the issue here, which is the internal social executive functioning skills of perspective taking and situational awareness, are not treated in a structured social skills group. So these social skills groups that are a very common recommendation for kids with ADHD who are struggling socially has been tested and does not work.
And what the research data shows is that office-based and clinic-based social skills groups doesn't work. So there are other things that can be helpful, like things that Mike does and that I do in my practice. But I think, Mike, let's explain to people a little more about this, because I think it's important people really understand. When I do presentations, my joke I always say is the requirement to run a social skills group is that you have a pulse, right?
There you go.
I don't think most people understand that there are no requirements to do this. I mean, anybody can say they run a social skills group. And you know what? If they do that and they market it correctly, they'll get kids, because there's such a belief, that anybody who struggles socially, this is what's going to help them.
Exactly. And why do you put your child in a social skills group? So they are more productive and more successful in the natural environment. So they're talking to peers at lunch, they're talking to peers at recess, they're hanging out with kids after school in person, not just on the phone, not just on video games, and you're seeing them make friends and keep friends outside of the group. If you're not seeing that from a social skills group, then what's really happening in there? They're probably playing a game and taking turns.
And learning scripted, socially appropriate etiquette, basically.
Correct. Things that really you never see with a bunch of young boys or young girls simply hanging out together, with social reciprocity and social relatedness. So that social relatedness, which is what boys really, really need, and girls, of course, need, is really something that you're not going to learn from a structured social skills group.
And I think the other thing, Mike, we need to mention is that, most people who run social skills groups, and again, people don't know what they don't know. So this is not about blame, but most of them will use a one-size-fits-all approach where they will put, a child with ADHD maybe in a social skills group with a child with more, pronounced autism. And because of that, because there's this mixed dynamic of kids with different profiles and different social learning needs, one of the things I've often heard from parents is, parent will say, well, my child went to this social skills group and the group leader said that he was the role model for the group or the highest functioning member of the group. And I say, well, that defeats the purpose of what you're paying for, right? You're not paying for your child to go and be a role model for other kids. And, you might think, well, that makes them feel good. But what are they learning, right? That's the whole thing, is that if their learning needs aren't being addressed, then they're not being addressed. And that is why, for myself, when I do my school year programs in summer camp, I do not take kids with an autism diagnosis. It's not because I can't work with them. It's not because I don't have a background in autism, but it's because often their learning needs are different and more pronounced than kids with ADHD. And I can't vary the instruction that much in a group. And that's the bottom line.
Exactly. And you have to look at exactly what these social skills training are. And you made a great point earlier, is you pretty much need a pulse to run them. So it's a common recommendation also because it's so easy to find. Schools can easily put that in an IEP. They can copy and paste it from their goal bank, put it in there, and put them in a lunch bunch group, during an unstructured session or, before after school or whatever, and just throw a bunch of kids together that tend to sit by themselves or tend to sit on their phone
Right.
or tend to sit on their Chromebook, and put them together. And the school is able to check that box like, yep, IDEA, yep, Students with Disabilities Act, yep, we got these kids covered. We got them in a social skills group. And
Exactly.
meanwhile, it's not doing anything to improve their quality of life.
Exactly. And you know what, Mike, I have to tell you, when I would, was just at the, the ADHD conference in November, and, I was presenting, a bunch of, school counselors came up to me and said, this was really helpful because I understand now why this does not seem to be making a difference. And what I tell them is, if you really want to help the students you're working with, go into the classroom and help them there, or go out to recess and help them there. That's where you're going to be most effective, not sitting in a lunch bunch group.
100%. And I've actually been surprised at how often schools have pushed back at that when I've mentioned that in IEP meetings with the students that we work with privately. Can you go into these unstructured environments? I can't tell you how often I hear from teachers, before school starts, when all the kids are kind of standing together, socializing, like in the hallway before they can go into their classrooms or whatever. And there's the one student you work with that's always off to the side. Oh, can't you help them and interject and, give them some skills to interact with peers during that unstructured time, kind of help out during that natural environment experience? And the responses I get of, oh, we can't force friendships. We can't do that during unstructured time. It has to be a structured social skills group. Let's get them in there and work on eye contact. I'm amazed at how much of pushback there is on that. And probably because it's not something that's structured and in writing in a report, so they feel like they don't have to do it.
Yeah. Mike, before we go to the next one, I just want to tell you this quick story. The high school that I graduated from, same school district my son went through, I was working with, a boy once. He was in high school. And, basically what I talked about with his mother was there's no point in him being in this, social skills group in school. So she asked me to come to the IEP meeting, to get that change, to get him pulled out of the social skills group. And I have to tell you, this was my high school where I graduated from. I had 7 people sitting around a table attacking me because I made this recommendation.
Really?
Yeah, 7 people from my own high school.
Okay.
And you know what? If it weren't for the mother being there, I would have stopped them and said, you know what? I graduated from the school. I pay your salaries through taxes.
Yep.
Yeah. But that just goes to show your point, Mike, about what you're saying.
Yep. And that's Kobe Bryant School as well, correct?
Yes, it is.
There you go.
Yes, it is. All right, so Mike, let's go to level 4 here, which is unknown or untested, and that is cognitive training. I'm going to let you speak to this because this is something really more pertaining to the speech language field than my field.
Correct. So this is another common recommendation we see of this cognitive training where the student or the individual is given different types of, basic brain games and different ways to kind of problem solve using, iPad apps or computer games or different puzzles or different things to sort of, train the brain to think different way and give the brain different types of experiences to solve and problem solve and things like that. So, to the layperson who's listening to this, it might sound like something like a Lumosity on your phone where you do these different games to train your brain. All the research shows to those cognitive brain-based games on your phone, all they really do is make you better at the actual games. There's no transition of those things into the natural environment. So once again, we're at another recommendation where the common theme is it improving quality of life? Is it bringing benefits into the natural environment? So you can do some cognitive training, some brain games. You can put them through different tasks physically or mentally or with their hands, fine motor stuff. And that you can see improvements and you can track data and the clinician can say, oh yeah, we're seeing improvement. He's getting really good at, this game where we, cover one side of his face and give him challenges with left brain, right brain, and all these different puzzle-based challenges and problem-solving-based challenges. And you can track data that they're improving, but once again, is it helping them to plan, prioritize, and problem-solve the issues in their life? Can they problem-solve independently for when to go to the grocery store, when to reach out to friends, how to get to work on time, how to get to school on time, how to hit submit after they complete their homework? Are those the things that are really improving? Is it quality of life, or is it the specific games you're giving them?
And what the research shows right here is that we don't know because it's unknown. So could it be helpful? Possibly. It probably doesn't make anything worse, but we just don't have any evidence that there's really any long-term benefit to it. So that brings us to the next one. Level 3 might work is neurofeedback training. Now, I want to address this because I actually went to a session where this was covered last year at the Medical ADHD Conference. What the research data shows is that neurofeedback can help short-term, but there is no evidence that it helps long-term. And there has even been some evidence, I think it was maybe just 1 or 2 studies that showed that it could actually make things worse in the long term, which I didn't really understand. But the bottom line is, yes, there could be short-term benefit, but the research data shows there is no long-term benefit to it.
Exactly. And this is another really common thing I see. And I actually hear from a lot of parents of, oh, my son did some neurofeedback and I saw a lot of progress and he was so calm and so regulated in the weeks after. But, what I tend to hear is that it wears off and it's not, real long-term skill building. So I do hear from a lot of moms and a lot of parents that, they did see progress and they do feel like it worked and it was beneficial. But again, here we are in another recommendation. Is it improving quality of life? Is it a true internal skill building that's going to help your child be more independent and less prompt dependent? Once again, the research is not quite there. That's why it's at level 3 might work.
Right. So moving on to level 2, what works, and this is a little confusing, I think, for the layperson reading this. It says combined training interventions. Now, what I take this to mean, and you might have a different opinion, Mike, I think it means, a combination of the things that we know work well, such as parent training and organizational skills training. So any combination of those things does show evidence of working. Is that how you understood this, or do you understand it in a different way?
Yeah, this sounds very similar to what we do at Grow Now. So basically what we do with the families is we have pretty much an hour session per week, and it's a mix between one-on-one work with the child and then, parent coaching and parent training all within those 60 minutes. And the way I kind of describe it to parents is, why do we do one-on-one work with the child? So we can work on that organizational training, internal skill building of, nonverbal, verbal working memory and all that stuff. But we also work with the child because it helps us to know the child as a unique individual, which then helps us to individualize our parent training towards that unique kid. So we get to know that unique kid on a personal level, what their likes, their dislikes, what makes them laugh, what gets them engaged, what gets them frustrated. And we build a relationship with them as a neutral third party, not that dynamic, unconditional love relationship like with their parents and, emotional manipulation and things like that. And that allows us to give the parent more individualized tips, not just blanketed advice, because we actually know who their child is.
Right. And for myself, what I offer is parent training, and then, my supplementary things, which is the school year programs and summer camp. That's what I do for kids. But the main thing is the parent training because, again, that's what the evidence shows works best. And when I have somebody who's looking for more of the executive function piece, I refer them to Mike because I don't do that myself. So, all right. So moving on to level 1, what has been tested and works well. So let's break this down a little bit. The first part is behavioral interventions, any combination. And those are, as listed here, behavior parent training, I'll scroll down so you can see it, behavioral classroom management, and behavioral peer interventions. So let's talk about what each one means. So behavioral parent training, people often get this confused with what's called behavior therapy. And behavior therapy is a vague term, but often when I hear behavior therapy, what I take that as meaning is like a mobile therapist who comes to the house and works with the child. And that's not what this is talking about. Behavioral parent training is training the parent in how to learn to manage behaviors and to facilitate pro-social or, appropriate behaviors. So there are various evidence-based parent behavior training programs out there. There's one called parent-child interaction therapy. There's parent management training. The one I really pull from is called Nurtured Heart Approach. That's one. And I pull from another one called Nonviolent Resistance. So this is the recommendation. I created my own because what I found was when I started studying all these different parent behavior training programs none of them were designed specifically for parents of kids with ADHD. So I wanted to bring in the element of executive functioning into it because that's what I felt that they were all lacking. They weren't addressing executive functioning. So the behavior parent training pieces, that's my main thing of what I do now and what I provide.
Absolutely.
So and the other thing I will tell you with this is that I read a statistic saying that only 40% of families are ever provided with a recommendation for behavior parent training. And I have to tell you, I find that very difficult to believe because I don't think it could be that high, 40%. Right? I would say I probably hear it 5% of the time, maybe.
Yeah, I totally agree. And especially, in this area, and I feel like, and you can tell me this is really your area. I feel like this is like therapist central of the world where I am over here in the Philadelphia region. And I never see this. The common theme that I hear is my son goes to therapy and I have no idea what's going on. So in terms of there being real structured parent training, parent communication, there's no way it could be 40%.
Well, Mike, to your point, I mean, I consider, I say Philadelphia is the therapy capital of America. That's my joke.
Yeah.
And I can think off the top of my head of 2 places in the entire area that offer parent training. Are there more? Probably, but they don't exactly advertise it, right? So This is something that you would have to know about. And I have had parents who've done PCIT, and I've had mixed reviews, some of it. And what the reviews were really about was not the actual program, but it seemed to be about who's facilitating the program. So I've had some parents say, yeah, it was really helpful. And then I've had other parents say, it wasn't really helpful. But I think that was more because the person who was facilitating the program was a little bit robotic or a little bit stiff, and not very relational.
Exactly. But to your earlier point, all of these more structured, curriculums and structured programs, we have to think about adding in that extra wrench of ADHD and executive functioning. When you have a child that has difficulty regulating their emotions, when you have someone who is time blind, who doesn't understand cause and effect thinking and perspective taking skills, and an inability to learn from past experiences and apply it to the present so your typical punishments and consequences don't work for them, this is a whole nother layer of cake here to add to this parent training. Adding in executive dysfunction and a 3 to 5 year delay in executive age really takes these parent training things and flips them upside down and completely changes everything to your credit for what you created.
Thank you. So let's talk about behavior classroom management and what that means, because I think that's another term that's often vague for parents. But my understanding of behavior classroom management, or not my understanding, I mean, I've seen it in action, is, for instance, some of the special ed schools I worked at for kids with behavior challenges, there was, a point and level system. So they could earn points and earn things, but points were not necessarily taken away. So kind of like, the positive behavior support model. So the idea that we're incentivizing these behaviors that we do on, in the classroom and, providing kids with, this tangible positive feedback and reward system, to help shape the behavior we want in the classroom setting.
Exactly. Yeah. And this is something that is also a big part of what we do. And this collaboration with the people that are with the child in the natural environment. So you do have kids with ADHD that, do fine at school, but not great at home. Some kids that are, fine at home, but not so great at school. If there are behaviors at school and issues at school, whether it's, self-regulation, academic-based, social-based, working with the individuals that see the child in the natural environment of the school, training them as if they were the parents, because, when the kid's at school, they basically are the parents, training them and getting everybody on the same page is super important.
Right. And, one of the things, Mike, I think is important to mention is, and, you're in touch with schools more than I am, but I often find that this is an area that schools often think, oh, we have this covered, but then when they're struggling with a student with ADHD, what we're finding is, well, maybe you don't really have it covered as much as you think. I find that schools tend to be much more open to, or much more receptive to, hearing strategies to help with executive functioning than they are with behavior, because I think there's this belief system in schools that, we know everything there is to know about behavior.
Exactly. And a lot of what is done is, it's all based on the specific school and what their training is, or what they did on a specific PD day, who they brought in to kind of train them, and whatever, unique curriculum they're trained in and understand. But a lot of it is just copy and pasted kind of stuff that, once again, does not bring executive functioning into play, because we know that basic executive functioning training is not required and is not part of the process to work with kids in a school.
Right. Mike, at one of the schools I used to work at, they would have a thing that, if you earn a certain amount of points during the week, then, last period on Friday, you can earn movie time or earn, something else. And of course, that was not successful because, as we know, so for kids with ADHD, they tend to live in the moment. And when something is outside of their time horizon, that's not going to motivate them. So telling, a 9-year-old, or even 11-year-old on Tuesday, keep doing this for the rest of the week, and Friday at, 3 o'clock, you can have this, that often does not work because it's outside of their time horizon.
It pretty much never works. And, and that's a lot of schools' go-tos is kind of that dangling that carrot in front of the child. And in many ways, it's, so the school worker who's overworked and underpaid can kind of get through the day and kind of, create something very simple in terms of a reward system of if this happens, then that happens. But, not only is that too far into the time horizon, but you're dealing with an ADHD student with self-regulation issues. The second they realize they've missed out on that movie or they missed out on that thing that they're working towards, get ready for some increased behaviors.
Right. Exactly, yes.
Yeah.
And that's what would happen every Friday afternoon in my school, right
There
around
you go.
2 o'clock. Yep. I knew
You
I was
got
going
it.
to have at least one kid in my office, right?
Yep.
Cursing about how horrible the teacher is. And yeah, exactly. So, and again, it's just the point that, when for kids with ADHD, that incentive needs to be immediate. If they're going to benefit from incentivizing positive behavior, we have to meet them where they're at, which is giving them that recognition, that praise, whatever that incentive is, rather immediately.
Exactly. Yep. So, really providing whatever, if it's an external reward, great, but there also has to be an increased focus on building internal, intrinsic motivation. We can't keep tempting these kids with these external rewards, but, it's something that, works in the moment and works short term, especially for the younger kids. But we do want to start to decrease the prompt dependence on self-motivation.
Right. So the last one here, which is one that most people haven't heard of, is behavioral peer interventions. And the reason most people haven't heard of it is because there's no programs out there yet. The reason I know about this is because I've done some training with a woman, her name's Dr. Amori Makami at University of Vancouver. And she did research maybe, 5-6 years ago now, might even be longer, where they developed a program where they would teach the class about ADHD, the entire class, with the intention of, if we can help educate kids about their classmates with ADHD, then they might be more patient and empathetic with them. And the research data showed that was helpful. It did help with that. So that's what behavior peer interventions would be. So in regard to this program that was tested, to my knowledge, it's still not out. I don't know if they're going to put it out. I should actually reach out to her and ask her. But that's the idea behind behavior peer interventions. It's about training the other students about ADHD so they could be more understanding of their classmates with ADHD. And,
Yep.
I have to say, Mike, and, I think in a lot of schools now do a good job teaching, neurotypical kids about autism, but I don't think they really focus on teaching kids about ADHD at all.
Yeah, absolutely. I totally agree. And it's so hard because it's such a lack of training at the master's level. It's very hard to find someone that truly understands the most up-to-date research on ADHD and executive functioning. There's still, the vast majority of people still today think that ADHD is an attention disorder, an attention deficit, all about hyper kids and inattentive kids. And they think executive functioning is just time management and organization. So to find someone that truly understands what it is and be able to take the principles of it into your child's plan and into your child's progress is incredibly rare.
All right, so the last one that is level 1, works well based on evidence, is what is referred to here as organization training, which I think is also a vague term like, behavior parent training. So I take organization training as meaning executive function therapy or executive function coaching. So let's talk a little bit, Mike, about, how you and I, would go about this and what we believe it should look like versus what is often presented to many parents as, executive function coaching.
Exactly. So just like the title of ADHD is a terrible name for ADHD, organization training is a pretty terrible name for, executive functioning coaching. Executive functioning coaching is so much more than just your basic organization training. It's really all about strengthening the internal skills that are lacking, which are the internal executive functioning skills. So executive functioning involves, number one, we have to develop some self-awareness skills, self-regulation of emotions, self-motivation towards non-preferred tasks, and the ability to self-evaluate. So strengthening, the nonverbal, verbal working memory, visual imagery, self-talk, to have an internal system of checks and balances so the child's not so impulsive. So the child does have an internal system to help them persevere and be resilient through non-preferred tasks, where they can think things through instead of just going through basic external organization.
The way I explain it, Mike, is I say that executive function training should look like we're getting to the foundational skills like the ones you just mentioned there, and there's nothing wrong with, helping with academic organizational skills, but that is not what real executive function work looks like to me, because that is a small piece of the much bigger picture here. And let's face it, at the end of the day, what the things we're talking about, these have to do with, affecting every facet of life. Whereas your academic organizational skills are not necessarily going to affect every single facet of your life,
Exactly.
So one of the things, Mike, I think will be helpful is let's talk to parents about what questions should they be asking a prospective coach or clinician who they want their child to work with for, executive function support. What questions should a parent ask this, prospective person who they might be hiring?
Yeah, so there's, lots of questions because there's so many executive functioning coaches. So, one of the most important questions to ask is, of course, what is your training? What is your background? What is your experience? And you can ask them, what are some of your, who are your favorite leaders and people you look up to in the field of ADHD? If they use some of the key terms like Dr. Russell Barkley, George McCloskey, Sarah Ward, some of those big names, that's great. They've taken some of those trainings. But you're also going to want to ask them, what's the connection between ADHD and executive function? What are some of the executive functioning skills? What are some ways that you're going to approach my child's ADHD deficits and improve them in the natural environment? So it needs to be about, how is my son going to gain these skills when you're not around?
Right. And there's nothing wrong with if you want your child to receive help for their academic organizational skills. But at the end of the day, when we're talking about if you believe your child's college bound, they're not going to fail out of college because their binders weren't organized neatly. If the reason we often see kids do not make it during that first semester of college is because they have been prompt dependent on an adult their whole life, or they can't manage their own sleep hygiene because they spend too much time on screens. So I think the point we're getting at is that it has to go beyond just the academic skills training or the academic organizational skills training, I should say. And if there are certain things like, you want to know about how can you help my child, learn to sense the passage of time. What I want to hear is something beyond, well, we'll use timers and that red countdown timer,
Yes. The red countdown timer might be one of the biggest red flags. So, so consider the red countdown timer a red flag. So if they talk about that and how they're going to use that in their therapy, you're probably going to want to see somebody else.
And Mike, let's actually go into that and explain why that is. Okay, because I think it's important for people to hear that.
Yeah, because that red countdown clock was so beautifully marketed to desperate, frustrated, tired parents of kids with ADHD, and they made a lot of money off of it. It's nothing more than a glorified kitchen timer, than a countdown timer. It's really something that is just used from time to time to help kids transition, but it's doing nothing to promote independence, decrease prompt dependence, and to understand the passage of time internally. So kids with ADHD can't sense the passage of time. They'll play Fortnite for 7 hours and it'll feel like 10 minutes. They'll look at a math worksheet with 2 problems on it and they'll think it'll take them 3 hours. They don't really understand that passage of time. And the red countdown clock, which really just, is a prompt dependent tool used by adults in the environment, does not teach them to sense the passage of time without it. So if you're expecting your child to bring that red countdown clock with them to college or use it on the morning of their wedding day, it's not going to happen.
Well, I think the other thing, Mike, too, is, to mention that, like you said, your child can be playing Fortnite for 7 hours, but once that red countdown timer is up, and time has passed, it's not showing how much extra time they've spent, right, playing Fortnite.
Correct.
And therefore, they're not learning how to sense the passage of time.
Correct.
Which is why neither of us recommend it. So,
and it's not the child using the clock. It's the parent doing it, setting it for them, and it's all the parent doing that tool for them. So it's really just a noise that's being made and a countdown clock there to help them transition from a task.
I mean, like you said, it's a fancy kitchen timer, basically.
Correct.
Yeah.
Correct.
And, Mike, we might have different opinions about this, but I think this is a good last point to talk about is when I hear about a kid having a, quote, executive function class in school, I'm typically okay with that because even though I know that they're most likely not going to be learning independent skills, it's going to be a time for them to get organized, maybe get some work done. So I'm never opposed to that in school. My issue is when parents are paying $150 an hour, for somebody prompting their child to organize their school materials. That's what I have an issue with.
Correct. So if it's a study hall where they get more one-to-one attention for their work and they're able to get work done at home and they're able to get work done at school within the walls of the school, great. I'm all for that. I am the number one fan of ADHD kids getting all their work done at school within the walls of the school and then being able to go home and play outside and not have to worry about academics and get into a 3-hour fight with their parents about homework. So if it's a glorified study hall where they can get work done and go home with no work and not even have to bring their Chromebook home, doesn't that sound nice, parents? Where they don't have to bring their Chromebook home, then that's a win-win for everybody. But if it's a class where everyone's sitting together, okay, take out your backpacks, throw away what you don't need, put this in the green folder, put this in the red folder, and then you have someone kind of just watching your child on the Chromebook, making sure that they're on the right tab the whole time. If it's something that's just keeping your child prompt dependent, then it's a waste of time for everybody. Because what we tend to see with this unregulated field of executive functioning coaches, where anybody can become an executive functioning coach, that's what it tends to be, is this adult who makes the child prompt dependent on the coach. So as soon as that coach leaves, the backpack's a mess again, the folders are a mess again, and they're right back to YouTube.
Right. And, I think, Mike, the other thing going back to schools for a minute is, if a kid has like a resource class or study hall, whatever we want to call it, again, I never have a problem with that, right? Because you're not paying for that directly. It's when, like you said, I mean, I've worked with kids who parents have had to pay $150 for a coach to sit on Zoom and prompt them how to organize their folders. That to me is not a value that's really being provided there, right? Because again, to your point, how is that going to help them, develop independence in the long run?
Yeah, and I think that's a great way to kind of sum up what we talked about today is, when you are looking at therapy or a program or coaching or whatever it is for your child, we have to kind of shift the focus from, does this make me feel good? Do I feel peace of mind? Do I just feel good that my son is doing something or talking to someone that he likes? And let's shift away from just that emotional aspect to it, to more of the reality. Let's go from being reactive to proactive. Let's be proactive here and say, okay, am I seeing real world progress? Is there less fights at home? Can he initiate, persist, and complete non-preferred tasks at home and at school? Is he making friends? Is he keeping friends? Is he having varied experiences? Does he seem, more pleasant and more regulated? Can he talk to me while he's in the car? Can he help me at the grocery store? Is there real world progress coming from this thing that you're devoting a lot of time to?
Right. So, Mike, to wrap this up, I just want to remind everybody, if they want to see the research data we're talking about, they can go to effectivechildtherapy.org, type in ADHD in the search bar, and this is the website of the Society of Clinical Child and Adolescent Psychology. And again, level 1 works well based on the evidence, behavioral intervention such as behavior parent training and organizational skills training. And level 2, what also works is a combination of these. So that's where you should be focusing on if you really want to help your child with ADHD. And yeah, I think that's pretty much it. Anything else you want to finish up with, Mike?
I would just say this is a really great podcast to share with, the people in your lives. I think one of the saddest things about, the ADHD world out there is just how much time and money is spent on therapies that really aren't recommended anymore. And, the way we started this episode was talking about, what the American Academy of Pediatrics has done, what some of the doctors and the neuropsychs who are under the pressure of insurance companies have done. I think this is a great podcast to share with, other professionals in your lives so they can hear it and they can become aware of, all that's out there now in terms of what works well and what doesn't. And let's keep spreading the word so families can stop wasting time and money.
Good plug, Mr. Mike. I like that.
There you go.
That was a good way to end.
There you
All
go.
right, Mike, where can we find you?
You can find me on Instagram at GrowNowADHD, and my website is grownowADHD.com.
And you can find me, type in ADHD Dude on YouTube, and the website is ADHDdude.com. And we will talk to you soon.
Bye, everybody.
Take care.
Thanks for listening. To learn more about Mike's practice, Grow Now ADHD, please visit his website at grownowADHD.com. To learn about the services Ryan provides, please visit ADHDdude.com. You can find Mike on Instagram at GrowNowADHD, and you can find Ryan at the ADHD Dude YouTube channel. The ADHD Guys podcast and content posted by either Grow Now ADHD or ADHD Dude is presented solely for general informational and educational purposes. The use of information on this podcast is not intended as a substitute for the advice of a physician, professional coach, licensed mental health professional, or other qualified professional, diagnosis, or treatment. Listeners should not disregard or delay in obtaining professional advice for any medical or mental health condition they or their child may have, and should seek the assistance of their healthcare professionals for any such conditions.